I'm Judiel Adesan from PhilCare Pharma, a Filipino national company handling anesthesia, anti-infectives, and critical care products. Doctors, I'm here to introduce to you the first-line treatment and diagnostic for wide and narrow complex tachycardia and a superior vasodilator stress agent in MPI. Dr. Adesan is a white crystalline powder that is soluble in water and practically insoluble in alcohol. It is sterile and non-pyrogenic solution for rapid bolus intravenously for injection. Each ml contains 3 mg of adenosine and 9 mg of sodium chloride water for injection. And doctor, just give you a background, doctor, an adult normal heart rate is at rest beats 60 to 100 per minute. Anything above or lower than the normal heart rate is considered as abnormal or irregular heartbeat, and which is also known as heart arrhythmias or cardiac dysrhythmia. And arrhythmias occur when the electrical signal to the heart that coordinates heartbeat are not working properly. For instance, some people experiencing irregular heartbeat which which may just feel like a racing heart or fluttering. Many of heart arrhythmias are harmless. However, if they are particularly abnormal or result from a weak or damaged heart, it may cause a serious and potential fatal symptom. But with the Adesan doctor as vasodilator stress agent and anti-arrhythmic agent, it provides significant utility to the to the it provides significant utility to the emergency and critical care. And Adesan injection is an indigenous nucleoside occurring in all cell of the body, and when injected intravenously, adenosine shows a nodal conduction that can interrupt the re-entry pathways through the AV node and can restore normal sinus rhythm in patients. And with the PSVT including with the PSVT including PSVT associated with the Wolff-Parkin White syndrome, it is antagonized competitively by mesyltines such as caffeine or theophylline that increase heart rate. And more so, Adesan is a rapidly cleared from the circulation via cellular uptake primarily by enterocytes and vascular cells with a half-life less than 10 seconds. In particular, Adesan is a rapidly metabolized either via deamination in the cytosol, and neither kidney or via liver are required for the metabolism or elimination of adenosine. Adesan injection is indicated for the convention renal to sinus rhythm of PSBT, including that associated with accessories bypass tracts by Wolff-Parkinson-White syndrome. And to cite the to cite the evidence in controlled clinical trials, cumulative 60% and 92%. Tapos 92%. Of patients converted to normal clinical trials. Sinus rhythm within 1 immune after 6 mg bolus of Adesan injection, respectively, in other controlled clinical trials with bolus of 6 mg, bolus of 369 milligrams and 12 milligrams. Some patient with PSBT dosage converted to normal sinus rhythm on 30 milligram of adenosine injection. And moreover, when adenosine compared to IV dipyridamole, our adenosine is a superior choice as vasodilator stress agents in MPI. And according to the Roseland study regarding the comparison of IV dipyridamole and adenosine is a direct coronary blood vasodilator, while the IV dipyridamole is a indirect coronary blood vasodilators that works by increasing the intravascular adenosine levels, and the coronary vasodilators blood vasodilators induced by IV dipyridamole is less predictable than adenosine. And to end, doctor, our adenosine is for only 890 pesos and now widely used in a major hospital, and it is FDA registered and successfully evaluated by Cedras Manila, and it is manufactured by SRS Pharmaceuticals, a GMP certified IV drug manufacturer. Once again, Doctor, I'm Judiel Adesan from PhilCare Pharma. Thank you for your time. I hope you will consider our adenosine Adesan as antiarrhythmic and vasodilator agent.